How many times a day do you use water? When you think about it, water is crucial to nearly every aspect of our lives. Now, imagine this vital resource is teeming with a parasite that infects over 260 million people worldwide. In many parts of the world, this is a common reality. A tiny flatworm that causes the disease schistosomiasis thrives in the water that millions of people depend on for drinking, cooking, and bathing. If that water touches your skin, you get sick. The good news is that schistosomiasis can be prevented and cured. Unfortunately, and despite the cure, schistosomiasis remains a disease of poverty.
Infectious diseases are still a problem. You forget that when you're talking about literally billions of people in the world experiencing some of the neglected tropical diseases, we really need to be conscious of remembering things like schisto. They exist. Kids still have them. They're still not getting treatment.
For nearly a decade, Tufts public health expert Karen Kaczynski has been studying schistosomiasis in Ghana, where it is a major health concern, especially for children.
We're looking at the intersection of schistosomiasis and water infrastructure specifically. So we're looking at prevention of that particular disease. It's not just about the hard reality facts. It's not just saying, is there contamination in this water body? It's really more about asking a child, does this river feel clean to you? Do you think this is a great place to swim, or would you rather swim someplace else? So asking a lot of those kind of questions.
The reason schistosomiasis lingers and spreads vary, so data on water quality is just part of the picture. Under the mentorship of Tufts epidemiologist Elena Naumova, Professor Kaczynski assembles teams of Tufts graduate and undergraduate students from diverse disciplines to assess infrastructure and prevailing cultural beliefs, as well as the personal preferences of affected communities. Research shows working with and understanding affected communities is just as important as science and medicine. Engineering graduate student Alexandra Kolinkina is developing a method to better predict where schistosomiasis is most prevalent in Ghana.
You can't separate the scientific from the people aspect of it, because we're ultimately trying to do something that benefits the people. The general approach of our team is to know as much as possible about each town and to see things from their perspective, to follow on the notion that there's no one-size-fits-all approach for each community.
The opportunity to go around and talk to women in the community was an amazing experience. Asking them about what kind of water they use and why they use that type of water. Is it because you think that using this certain type of water is contributing to your spiritual beliefs? Is it because another source may turn your food black, or like it makes your clothes smell?
Even though there's a drug for schistosomiasis called praziquantel that is very effective, it doesn't prevent against reinfection. So if a group comes into a school and they treat everybody, but nobody knows that they're getting it because they're swimming in the river, they can get reinfected that same day. So what I'm doing for my research is I'm trying to figure out what knowledge grade school and middle school students have about schistosomiasis. If people know what behaviors they need to change, they have the opportunity to do so.
Our team really tries to avoid kind of coming in and telling people what to do, and rather we try to work with people and ask them what their complaints are about their current water sources and really take those into account when we are mathematically modeling things or just using qualitative data or anything like that.
By evaluating the entire scope of factors contributing to the persistence of schistosomiasis in various communities, the Tufts team is developing methods to forecast where the disease is likely to be a problem in the future. This information can be used to tailor specific medical treatment, infrastructure improvements, and education for each unique situation. The researchers remain confident that their work will assist government agencies and aid organizations to more effectively refine their efforts to treat and prevent schistosomiasis. Ultimately, these strategies can be a model for managing other waterborne infectious diseases around the world.
That's the main point of everything that we're doing. I mean, we want to improve the lives of people that we meet and to prevent the spread of disease, which is something that needs to be established worldwide.